Hi everyone, this is Brandy, Rocky Mountain Green Eyes. This is my week 19 video update for gastric bypass surgery. This morning I weighed in at 215 pounds, which was a loss of 3 pounds from last week. My starting weight was 294 pounds, so my total weight loss for week 19 is 79 pounds, which is good. I'm happy with that. I know last week I was telling you I was a little bit frustrated and that I needed to change up some things. So I'm happy to announce that I'm sticking with those changes, and I feel like they're working and they're helping me out a lot. Another thing I wanted to talk about today, I went to the nutritionist last Wednesday, and I had her measure me different parts of my body, which I haven't had her measure me since a week before surgery. So I wanted to share some of those numbers with you. First off, she measured my waist, which before surgery was 51 inches. Now it is 41.5, so that's a loss of 9.5 inches. My hips were 58 inches. They're now 49.5, which is a loss of 8.5. My left upper arm was 17 inches, now 14 inches, a loss of 3 inches. My thigh was 28.5 inches, now 25 inches, a loss of 2.5. I did have her measure a couple of different unusual spots, which they don't usually measure, I guess. I had her measure my neck. One reason is this necklace here that I'm wearing. This is one of my favorite necklaces. It's a choker, and it used to choke me. My neck used to be 16 inches. I used to have to put a little extender on the back of this necklace. I actually quit wearing it for a long time because it was too tight. Now my neck is 14 inches, so those extra 2 inches have given me some space. So now I can wear one of my favorite necklaces. And I also had her measure my wrist. They don't usually measure your wrist because they don't typically think that you're going to lose weight around your wrist, but I have pretty big wrists. So this baby used to be an 8.5, which meant that regular bracelets that you could buy in any jewelry store or regular jewelry or regular store usually didn't fit my wrist because it was too big. So now my wrist is a 7, which is the normal size of regular bracelets. My wrist is still pretty big. I don't have a small body frame. Whatever, it's fine. Anyway, that's a total of 27 inches lost on all of those points on my body. So that kind of gave me another bit of encouragement. Sometimes when you measure yourself, especially when you don't think that you're losing any weight, I know that how my clothes fit is my gauge as to how much weight I'm losing. I do pay attention to what the scale says, just so that I know that I'm keeping on track. But really, when the pant size goes down, that's what keeps you motivated. And something else I wanted to discuss tonight with some of you newbies out there that are thinking about having gastric bypass surgery. I know that initially you're scared and you're afraid that it might be too painful or that they're making too many changes inside of you. But you know, I guess I have a really good story. My surgeon did an excellent job. I was in the hospital for 2 days after surgery, and that was only because I lived 2 hours away from the hospital from where I had surgery. They just did that for precautionary reasons, just in case something happened. I didn't have to take any pain medication while I was in the hospital or after I left the hospital for the next week. I just didn't need it. I had 2 different prescriptions to help me sleep and to get through pain. Sorry, my cell phone is beeping. I lost my train of thought. But anyway, you know, I had a wonderful surgery. My incisions healed up quickly. Hopefully the scars are going to be super tiny. I know they're going to fade quickly. I do put vitamin E oil on them to help lessen the pinkness of them. So far, I don't believe that I'm having any problems with excess skin. You know, I still have a ways to go. I still have 25. I still have 75 pounds to lose before I hit my personal goal of 140 pounds. So I'm a little over halfway there. I guess we'll just have to see what happens when we get there. So far, it looks like my arms are staying pretty intact. I know this shirt doesn't really show, but everything seems to be staying pretty tight. My plan, if I do have some excess skin, I'm gonna pump some iron and fill that skin with muscle. Another thing I wanted to talk about was support groups. You know, I attend a support group for weight loss surgery patients once a month. The next meeting that I go to is on Wednesday. You know, and I do think that it's important to have live support as well as support on YouTube. I love the weight loss community on YouTube. They're a wonderful support for me. Every week I gain more and more knowledge and different ideas for things that I need to be doing. But you know, more than anything, in person, some of those weight loss support groups, it's good for us to be going to those things and sharing our experiences and sharing our knowledge, especially from what we're finding on YouTube, because I know some of the older crowd, which is a lot of the people who are getting weight loss surgery, they don't even think to look on YouTube. And even if you tell them to check out YouTube and find some inspiration and different tips, they shy away from looking on YouTube, which is fine. But I find that the people that I attend these support group meetings with, they find some of the knowledge that I'm gaining from YouTube to be very beneficial to them. So, especially for people who are thinking about having this surgery, talk to somebody in person, see what they actually look like, and talk to them about their experiences, and maybe they can guide you to a good surgeon. I wish that I had that prior to my surgery, but I feel like I lucked out and I got a great surgeon. It looks like this video's turning out to be a longer video than I had expected, but I'm finding I'm having a lot more to say now that I've been on YouTube for a couple of weeks now. I'm not as nervous as I used to be, so I just want to take a quick moment to thank everybody for subscribing to my channel and all of your kind words and support. It really keeps me going. And if you know, I would love to have more subscribers, so if any of you out there would like to maybe make a suggestion to some of your subscribers, that would be awesome. I would love it. So anyway, have a great week.